I saw a gentleman this week for a nightstick fracture. A nightstick fracture is a special fracture here on the shaft of your ulna. That's one of the bones in your forearm. It kind of has a history behind it. The name itself is named after people trying to protect themselves as they're being struck, technically by the police with like a nightstick or a baton, but really can be by anybody. Usually a patient's trying to protect themselves. Maybe they're getting assaulted, getting hit by a bat, and it takes the brunt of the force there as they're trying to protect their face. Most of these nightstick fractures can be treated conservatively with splinting for 4 to 6 weeks. So interesting, my patient actually fell off a deck. Kind of that fall in the outstretched hand broke that bone, and unfortunately, it was displaced fairly significantly. I sent him to the orthopedic surgeon. Unfortunately, some things fell through the cracks. He was immobilized for a total of about 6 weeks. They opted not to do surgery for various reasons. And now, fast forward 6 months later, he's developed something called a non-union. In other words, the bone has not fully fused together. I think the fact that fracture was displaced and shifted was one major risk factor. And then also, the patient was a pretty heavy smoker. Smoking is a major risk factor for fractures just not healing well. So remember, nightstick fracture, kind of a weird mechanism and history behind it. And also, non-unions can happen if the fracture just does not unite and come together after many months.